just a remarkable group of people. And out of such a remarkable group of people, some wonderful things can happen. And that's obviously the purpose of meetings like this, is to get people together from different walks of life, different perspectives, different disciplines, so that we can come together to figure out how it is we can learn from one another, teach one another, potentially partner with one another for the purpose of, at the end of the day, providing better care to people who need it the most. So I'm Mike Dowling, and I am the President and the CEO of Northwell Health. And I want to say, for those of you that have been here in the past, I welcome you back. This is our 6th Constellation Forum, and we have quite a number of people who come each year. But we also have each year quite a number of new people who join, so we welcome you. I also want to welcome the people who are watching in virtually. They tell me that right now there's about 1,700 people watching virtually. So if you put the group here with that, we can all sit around saying that there are going to be about 2,000 people listening to what we say. So when you get up here, those of you speaking, there are just 2,000 people listening. Not to get anybody worried about this, of course, but technology is part of the agenda for today. Innovation is part of the agenda. And you know, as you all would agree with me, that we're on the threshold of an era of extraordinary opportunity. Wonderful opportunity to be able to improve what we all do, so that the product and the products that we deliver are better. But that opportunity is also sprinkled with a little bit of apprehension, a little bit of concern, a little bit of worry, because we all know what technology can do. It can dramatically improve care. It can help us diagnose better than we can do it today. It can prevent us from making errors that we make today. It can help us improve communications with patients, enhance relationships with physicians, do things more effectively and efficiently. All good stuff. But as social media has clearly demonstrated to us over the years, technology also comes with some downsides. So we've got to be careful. We've got to do that which is right. It's not a panacea for everything. We've got to make sure we know when to use technology and the new innovations, and we've got to know when not to use it. And we've got to know how to use it. We understand the realistic potential that exists, but we have to be somewhat careful about a tendency to exaggerate. All good. But in the healthcare arena, especially on the provider side, which is where those of us at North Shore spend most of our time, we have to be very, very careful not to allow technology to completely substitute for the human element that is so important and so necessary to the efficient and humanistic delivery of care. Like every innovation over time, it comes with all of this potential, but also something for us to be realistically cautious about. So I think over the next number of years and decade, we will be in a period of major discovery, trying to figure out what works well and what doesn't. How to avoid the pitfalls that can come with dramatic, quick, and fast progress. But this is why partnerships are important. This is why by us working together, learning from one another, understanding each other's fields, understanding what matters to patients and the community at the end of the day, what matters to us all as we try to enhance equity, reduce inequity, enhance access, provide better outcomes. That can only happen by us all learning from one another about how to do it well. So this period of discovery is going to be extraordinarily important for all of us. And remember, it's not just only about the success of our own individual businesses. All of this is about the eventual success of providing best care to people out in the community and improving health overall. Because if we don't accomplish that, and we each in our own domains become unbelievably successful, we'll have failed. Important to keep the real goal in mind. So, again, I welcome you. I am delighted that you are all here. And before I walk away from the podium, I want to say a special thanks to all of the staff that have worked with us, Northwell staff and others working with them, for making a program like this possible, for putting the program together, for making today successful, as I know it will be. So to all of the staff, if I could have a hand for all of the staff, I appreciate it. Okay. And with that, let me introduce the person who will be your MC for today, Dr. David Battinelli. But David is the physician-in-chief of the health system, and he is also the dean of the Zucker School of Medicine. So with that, let me hand it over to David. And again, enjoy, learn from one another, have a wonderful day, and let's end up with improved partnerships. Thank you so much.